Chalazion. Introduction. A chalazion is a benign, slow-growing lump or cyst that develops in the eyelid due to blockage and inflammation of the meibomian gland. Unlike a sty, which is an acute bacterial infection, a chalazion is a chronic, non-infectious condition that may cause discomfort and cosmetic concerns. Definition. American Academy of Ophthalmology, AAO. A chalazion is a slow-growing, painless lump in the eyelid caused by a blocked meibomian gland, leading to inflammation and swelling. Mayo Clinic, a chalazion is a small, usually painless bump that forms on the eyelid due to an obstructed oil gland, often resolving on its own without treatment. Risk factors. Chronic blepharitis, seborrheic dermatitis, acne rosacea, previous chalazion episodes, high lipid levels in tears, poor eyelid hygiene. Etiology. Blocked meibomian gland, accumulation of oil secretions leading to gland obstruction. Chronic blepharitis, inflammation of the eyelids that increases the risk of gland blockage. Seborrheic dermatitis, a skin condition that affects oil gland function. Rosacea, a chronic skin disorder that can lead to ocular inflammation. Poor eyelid hygiene, can contribute to clogged glands. Pathophysiology. Meibomian gland blockage. Obstruction of the meibomian gland prevents normal oil secretion. Down arrow. Accumulation of sebaceous secretions. Trapped oil builds up within the gland, leading to swelling. Down arrow. Chronic inflammatory response. The immune system reacts, forming a localized granulomatous inflammation. Down arrow. Formation of a painless nodule. A firm, non-tender lump develops on the eyelid due to persistent inflammation. Down arrow. Possible secondary infection or spontaneous resolution. In some cases, infection may occur, causing pain and redness, while others resolve naturally. Clinical manifestations. Painless, firm lump on the upper or lower eyelid. Mild eyelid swelling and redness. Blurred vision, if large enough to press on the cornea. Occasional tenderness in early stages. Cosmetic concerns due to visible swelling. Diagnostic evaluation. History taking. Chief complaint, presence of a painless eyelid lump, swelling, or mild tenderness. Past medical history, history of recurrent chalazion, blepharitis, rosacea, or seborrheic dermatitis. Family history, any genetic predisposition to chronic eyelid inflammation or skin conditions. Trauma history, any previous eyelid injury or frequent eye rubbing. Medication history, use of topical or systemic corticosteroids that may contribute to gland dysfunction. Physical examination. Visual inspection, observation of a localized, firm, painless swelling on the eyelid. Palpation, assessing the consistency, mobility, and tenderness of the eyelid lesion. Eyelid eversion, checking for meibomian gland obstruction or any signs of internal inflammation. Slit lamp examination, evaluating eyelid margin abnormalities, associated blepharitis, or conjunctival involvement. Advanced diagnostic tests. Meibography, imaging of the meibomian glands to assess gland dysfunction. Dermoscopy, used to differentiate chalazion from malignant eyelid tumors. Histopathological examination, if needed, performed on excised lesions to rule out sebaceous carcinoma in persistent or atypical cases. Biopsy, if needed, performed in rare cases where malignancy is suspected. Management of chalazion. Pharmacological management. Topical antibiotics, erythromycin, tobramycin used if secondary bacterial infection is suspected. Topical corticosteroids, fluorometholone, loteprednol reduces inflammation and swelling in persistent cases. Oral antibiotics, doxycycline, tetracycline prescribed for recurrent chalazion, especially in cases linked to blepharitis or rosacea. Nonsteroidal anti-inflammatory drugs, NSAIDs helps relieve pain and inflammation. Warm compress therapy helps soften and liquefy blocked meibomian gland secretions, aiding drainage. Non-pharmacological management. Lid hygiene, regular eyelid cleansing with baby shampoo or lid wipes to prevent gland blockage. Warm compress, applying a warm compress to the affected eyelid 3 to 4 times daily for 10 to 15 minutes to promote drainage. Eyelid massage, gentle massage after warm compress application to facilitate secretion drainage from the meibomian glands. Avoidance of eye makeup and contact lenses, helps reduce irritation and prevents contamination. Omega-3 fatty acid supplementation, helps improve meibomian gland function and reduces recurrence risk. Surgical management. Incision and curettage, a minor surgical procedure where the chalazion is drained under local anesthesia. Intralesional steroid injection, triamcinolone used for persistent or large chalazion to reduce inflammation. Laser treatment, used in cases of recurrent or non-resolving chalazion to improve drainage. Dietary management. Vitamin A, carrots, spinach, sweet potatoes supports eye health and meibomian gland function. Omega-3 fatty acids, salmon, flax seeds, walnuts reduces inflammation and prevents gland blockages. Hydration, drinking sufficient water to maintain meibomian gland function. Nursing management. 1. Nursing diagnosis, risk for infection related to inflammation of the meibomian gland. Interventions. Educate the patient on proper eyelid hygiene to prevent further infections. Instruct on the importance of hand hygiene before touching the eyes. Encourage compliance with warm compress therapy and prescribed medications. 2. Nursing diagnosis, risk for discomfort related to eyelid swelling and irritation. Interventions. Apply warm compresses as advised to promote drainage. Educate on avoiding eye rubbing to prevent irritation. Administer prescribed NSAIDs or antibiotics as needed for symptom relief. 3. Nursing diagnosis, deficient knowledge related to self-care management of chalazion. Interventions. Teach the patient proper lid hygiene and warm compress application. Explain the importance of completing the prescribed antibiotic course if given. Educate on symptoms of complications requiring medical attention, example increased pain, redness, vision changes. Difference between STI and chalazion. Feature. STI. Chalazion. Cause. Infection of eyelid glands. Blocked oil gland. Pain. Painful. Painless. Appearance. Red, swollen lump near eyelash. Firm, round lump on eyelid. Onset. Appears suddenly. Develops slowly. Treatment. Warm compress, antibiotics if needed. Warm compress, may need minor surgery if large. Contagious. Yes. No. Conclusion. Chalazion is a common eyelid condition caused by the blockage of meibomian glands. Early management with warm compresses, eyelid hygiene, and medication can prevent complications. In persistent cases, minor surgical interventions may be required. Patient education and preventive measures are crucial to reducing recurrence.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.